Good morning, ladies. Today is Thursday, May 9th, 2019, and I am 29 weeks and 5 days pregnant, so almost 30 weeks. So a little more than 10 weeks to go, and that's if we go full term, like the full 40 weeks. So I'm thinking at most 10 weeks, but could definitely be sooner than that, which is terrifying, but I'm not going to harp on that right now. I just wanted to come on and give you guys an update in regards to what's been going on with me this past week, and really just, the biggest symptom, two symptoms I think I've had this past week has been the heartburn and the indigestion. Like those things have been the heartburn, indigestion. I'm sorry, it's pretty much the same thing, and the swollen feet. Those things have been the worst. My feet have been swelling up, where it's uncomfortable sometimes. I've still been wearing pumps at work though, so I probably shouldn't really complain. But the heartburn has been horrendous at night. During the day, I don't, it happens. It's just bad. It doesn't really even seem to matter what I eat. Of course, depending on what I eat could be worse, but it doesn't really seem to matter what I eat. It's just been horrendous. So, I've been taking Tums, and Tums didn't work. So, I mean, they worked before when it wasn't as bad, but since it's gotten worse, they don't seem to work for me as much. So I, went to the list that the doctor gave me with medications that were safe to take during pregnancy, and on that list there was Zantac, and I decided, because I did have Zantac in the house at the time, to take it, and so I have been taking that, and I'm pretty much taking you can take up to 2 pills a day spread out with those, I guess maybe 12 hours, and that's what I've been doing. And I really don't want to take it because I'm trying to not take his medications and stuff, but especially at night, I can't even sleep. And so anything that I eat, whether it's oatmeal, just anything, has just been really causing a lot of indigestion and heartburn for me, to the point it's uncomfortable and sometimes painful. So when it started getting painful, I said, okay, we have to do something. And then at night, where it's already hard to sleep because it's already hard to get comfortable, I think if I didn't have the heartburn, I'd be a lot more comfortable. So that's just what I've been doing. And as I said, that medication is on the list of medications that are safe to take. So, I'm doing it. And the swollen feet is what it is. I'm not doing anything about it. I do have a foot massage soak thing at home that I could see if it works, but I've been too lazy to do it. It's really been laziness. So I don't even know if that works, but other than occasionally having my husband massage them, and even that is just, it hasn't really helped, but it is what it is. So those are my main symptoms right now. So I kind of also wanted to talk about, yesterday I went on a hospital tour, at the hospital where I plan to deliver the baby, which is New York Presbyterian Lower Manhattan. And so you can go on a tour. I think probably all hospitals do this, a tour prior to delivery, just to, tour, see what the delivery rooms and stuff look like. So it was pretty interesting. I was a little disappointed because they don't have a lot of private rooms. They only have 5, and they're given out on a first come first serve. And it's not when you arrive, it's based on the time when your baby is born. So although the labor and delivery room is private, the postpartum room are semi-private unless you get in a private room, and again, it's based on what time your baby's born. So even if you're there and you're laboring for 36 hours, and someone else comes in after you and pops their baby out, baby's born before yours, so they would get on the list first to be in the private room. So, so that's a little annoying. Otherwise, you're in a semi-private room, which basically is two mothers who just had their babies. And because of that, they have restricted visiting hours. Well, I guess all hospitals have restricted visiting hours to some extent, but the visit hours there are like 7 a.m. to 9 p.m., which, and they only allow 2 people at a time. So that's annoying. However, the significant other, the father, or whomever you designate as your partner, so to speak, and whomever it is, that person has complete access, but they cannot spend the night. So it's weird. Although they can stay past the visiting hours, of course, but they cannot spend the night. So it's kind of weird, like I said, because you're saying they can't sleep there. Let me put it that way. They can't sleep there, but they can stay because they have 24-hour access, but technically they're not allowed to sleep there. So I guess if the person stays and they're not sleeping, it's fine. So it is annoying unless you get a private room, and then private rooms are not covered by insurance, so you have to pay whatever it is to upgrade, which I have no idea what that costs either. So there's also that. There is an additional cost. But if you do have a private room, then your husband or partner, or whomever, the father, whatever is going on in your life, can stay the night. So that's annoying to me because I don't want, my husband to necessarily leave the night the baby is born. If he's already said he wouldn't, then he would stay. But, so my understanding is that a typical stay for a vaginal delivery is, at this hospital, is 2 nights and 3 days. And for a C-section is 3 nights and 4 days. So if you stay the typical stay amount of time, then, though you may have time where you're, the person, maybe your husband or whomever is not going to want to stay that entire time, because there's a lot. Hospitals are not the most comfortable. This place is supposed to be, have really nice furniture, really comfortable furniture, but even with that, is it something you're going to want to spend multiple nights on? I don't know. So if he needs to go home, that may be great. And, well, not great, but, I'll have to deal with it. I'm not usually so clingy, but I don't know, this experience, I'm kind of like, I don't want to be by myself. And also the reason why it bothers me is because my mother wants to be there for the delivery, and I would like her to be there. But my mother is visually impaired. She has complete blindness. So she would not be able to just leave at visiting hours by herself. So, we would need to make accommodations for someone to be there to, bring her back and forth. So my mom was the only other person that I planned to have in a labor and delivery room. So then otherwise, I didn't plan to have my dad there, but do I need him to come pick up my mom? So and my parents live out of state. That's another thing. So my mom was going to come and visit early to be here for the delivery. My dad was not necessarily going to come until after the baby was born. So, it is a situation where, my parents have to figure out how logistically we can work this out, because they're saying that people can't stay. I thought she might be able to stay also. I actually thought, maybe I'm naive, but I thought that my husband would be able to stay and my mom would be able to stay until I left. And again, they may not want to stay that long if it's, 2 nights. But that's what I thought. But it may be okay if the first night we can finagle or finesse something. I mean, who's going to kick the blind lady out the hospital? I don't know. But they might. They might. And, my husband, they can't really kick out because he has, he has that access. He's not supposed to sleep there. But if my mom has to go, he'll go and come back. But it's all very annoying because, I want to have these people there, but I don't necessarily want drama at the time. I also don't want to spend a lot of time alone. So we'll see. I know at one point my husband was saying he would be there the entire time until the baby comes home. But then we were thinking maybe if there is 2 nights, on the second night he could come home and get some rest. And, that makes sense. I can't be selfish. But anyway, yeah, I mean, it was fine. It was, the way this hospital does it is that first and maybe this is how they all do it, I don't know. First you triage when you come in, and if you are actually ready to go into labor, or they keep you, then they'll move you into labor and delivery room. If you're not, then they'll send you home, or they said they might have you walk around a little bit and then send you home. And so when you're in triage, it's not private. You're with up to 2 other moms. So I guess it could be 3 moms in the triage area at the same time. At least, I don't know if that's a room or what it looks like. We did not see that, but you could be in that together. And then you move into a labor delivery room, which is private. But the annoying part is that if they back up on postpartum rooms and they're waiting to get someone into a postpartum room, they can stick a mother who's already given birth in your labor and delivery room. They'll split your room and put her in there. And I do have a problem with that. I mean, it's nothing I can do about it. I'm just hoping I don't fall into that category, but I do have a problem with that on both ends. One, because if I'm in labor, I do not want another woman, and you have enough strangers in there, so maybe I won't care. Maybe there'll be so much going on and I really won't be thinking about it because you have a ton of strangers in there. But I really don't want to have this woman in the room, even though she'll be, curtained off or whatever. I don't want to have her in the room hearing what's going on, or really being in that very private time. But is it really a private time? Because like I said, you'll have a bunch of other strangers running in and out. But that is supposed to only be for a short time, and it's just, for a little bit, and then they move her out. I also don't want to be the woman that they move into someone's room while she's, in labor or delivery or whatever you call it. I don't want to be that, because I kind of, I would want her to have her time and to herself, and, get me in a room as soon as possible. Don't do that. And so anyway, so after that, you moved to the postpartum room. As I said, the odds are it will be semi-private, and then you could get the private, but I don't know. And even like I said, if you get on the list to get private and you are chosen to get the private room, you do still have to pay for it. But the good thing is that it's private, and you can have your people spend the night, so that makes it a little more comfortable for them also. I guess that was really, I mean, it's not, I'm just looking at the list of notes that I wrote, because I took a lot of notes. Another thing, this hospital does not let you videotape the birth. They will let you take pictures, but they say no videotaping. In the moment, I guess if you really need to, you could. I don't know if they'll stop you, but they do say no video. The woman who did the tour said no videotaping, but you can take pictures. And the reason they didn't want it videotaped is that they said people were posting pictures of nurses and all of that, and I guess it's for the nursing staff and doctor staff for their privacy, hospital staff privacy. And so people weren't being mindful of that, and that they were posting things and without permission. And so they just ask that you don't, although you can take pictures. So I mean, go figure, if you get them in the picture, I don't know. But at the same time, they just had an issue with videotaping. And this hospital has been like this, where like every ultrasound and every visit I go to, they have a sign in the room that says no videotaping. I've wanted to videotape this stuff, but they said no videotaping. On my 20-week ultrasound, the tech did allow us to videotape it, and we did videotape it. It's like a 45-minute long videotape that I did not watch, but my husband did videotape it, or record it. I'm saying videotape like it's the 90s or whatever, but my husband did record it. But yeah, but I didn't watch it, so I was there, so I didn't watch it. I figured it's a look back on video. I didn't, I haven't watched it yet, but he recorded the whole thing. So there is that. And that was only because that tech was okay with it. But she also said that it is not allowed. So when the doctor comes in to please turn it off, but that she didn't have a problem with it. So I guess it could be something like that, case by case, but overall the policy at this hospital is no videotaping this stuff. Now, if you have a C-section, they said that if you're awake, then you can have the significant other, your partner or whomever, in the room with you, but you're only allowed that one person. If you're not awake, then no one will be in the room, and then you'll just see them at the recovery room later. They do really focus on skin to skin, so as soon as the baby is born, they will clean off the gook and put it right on your chest. So they're really big on skin to skin. They also said that if mom is not available or not feeling well, they believe in skin to skin with dad, and they encourage it. Even if mom is, available and feeling well, they encourage the father to participate in skin to skin, which I think is great. It's supposed to be really good medicine. There's a lot of studies that have been done, so I think it is accepted because hospitals are really on top of this skin to skin thing. And as I said, it also increases bonding. So, but it's not just bonding. It helps to calm down the baby, the heart rate for both, my understanding, both the baby and the mother. So, Google it. There's lots of studies about it. Skin to skin is supposed to be a great thing, but if you're not into it, it's totally your business. As everything with this, they're all personal decisions, but it's great that this hospital encourages both mom and dad to do skin to skin. So, that's good. Now, on the skin to skin topic, also one thing that, I don't know if it's been proven or not, but not having the baby bathed right away is supposed to help with, the bonding and the, breastfeeding and, all of that. So, there are some, I don't know if they're true studies or just suggestions that you can hold off. They still clean the gook off the baby because babies apparently come out very messy, but they do not bathe the baby right away, and so they'll bathe them later, I think. So it's like they just don't bathe them right away, and so that's supposed to you help with bonding and also breastfeeding. So, and there may be some other reasons why they do it. I don't know if I'm going to have that delayed. They do give you that option here, but you have to request it. And my concern is that in the midst of everything, I probably will completely forget to tell these people not to bathe the baby right away, because I don't think that'll be my focus. And so, even though why not? If I remember, I'll definitely ask them not to, because I don't think it could hurt. But at the same time, if I forget, I forget, and then hopefully that doesn't, I don't beat myself up too much about it. As I said, I am very interested in breastfeeding, but I may not be able to, given the breast reduction I had about 10 years ago, or over 10 years ago, or roughly 10 years ago. I don't know. But anyway, so I am interested in having it delayed, the bath delayed, but whatever. Yeah, and they also said don't bring a lot of stuff there. They said they provide everything that you need for the most part, even toiletries, unless you are very picky about your toothpaste or something. But other than that, all they said you need to bring is the car seat, clothes for mom, and clothes for baby, to go home in. That you really don't have to bring anything else, and they actually will prefer you don't bring a lot of stuff. Now, they provide, of course, gowns, right? They have the toiletries, they have undies, mesh underwear, which I believe all hospitals give away, pads, towels. They said everything that you need, they will be able to provide, the socks and all of that. You'll read a lot of things online where people are saying bring your own stuff, and I guess if you're very particular and you want your stuff, then you should. But I went into some of those rooms and they weren't the largest rooms here. Maybe if you're in a different place. I am in New York City, so if you're in a different place, you may have bigger hospitals that have really huge rooms, but it ends up making the room, well, and this was the reason they say it makes the room kind of tight, and when you're maneuvering, you have bags and bags, it is hard to do that, so they don't really suggest you bring a whole lot of stuff. And so yeah, so I already have my gowns and I am going to bring them, although I think I've changed my mind on wearing either one of them during the actual labor and delivery, because I do think they're going to get disgusting and I'm not going to want to take it home. And some you just throw away. And my understanding is women who wear their own gowns during the, delivery often just throw them away. But I don't want to. So I showed you guys the black one, and I think maybe I'll wear the black one home and I'll wear the pink one with the robe after the baby's born and like the recovery, or maybe a little bit before. But I don't want them to be ruined, or they're staying right there at the hospital. Like, I'll just throw them out, because I don't know, it's not really sanitary to carry. I mean, you can't carry it home and wash it, but it's just like, once they have possibly poop and urine and blood and amniotic fluid all over it, to put it in a bag and carry it home and let it sit in the bag for like 2 to 3 days and then carry it home. I don't know. Unless, my husband takes it home right away and washes it, which I guess is also an option. I think that's it. I don't really, they talked about filling out the forms for the birth certificate, vaccines, the different tests that they give the baby right away. They have a photography company that comes in to take pictures of the newborn. Of course, it's your option, but they'll take the pictures even before you pay for them, and they put them online, and you don't have to pay. If you don't like them, you can look at them first. So that's all great. So now I can probably get some of those cute newborn outfits. Of course, I still don't know the sex, so it's more and more pressure. I find that as I get further along in this, I have more pressure to find out the sex than I did before. Earlier on, it was easy not to find out the sex, but now I feel like it's more pressure for me to find out the sex, because buying a cute going home outfit or buying picture outfits, it's just like, I'd like to know, but I don't know. I said before, I'll buy one for a boy and a girl, but those outfits could be expensive. I'm looking at some on Etsy that are like $70 for the booties and the little onesie and a skirt and a headband or something. And then for the tulle skirt, I like the fluffy tulle skirts. I don't know, very girly. And for a boy, they have some that look like little onesies suits or whatever, with a little fake tie, with a fake suspenders and a little clip-on tie and little pants, and some of them have a hat and all of that, and they're really cute, but they're like $70. So I don't know. I'm trying to find something that's just as cute, but maybe not as expensive, especially given that I won't be able to use one of them. So spending that type of money and having virtually one of them being not used would be annoying, unless I gift it to somebody or have another child and it's the opposite sex. But yeah, so I don't know. I don't know if any of this is typical. I think the biggest issue I have is the hours, the visiting hours, and whether my mom will be able to stay or not. I mean, I could just be gangsta and go up in the hospital with her, and of course, which they'll allow, but then when they say visiting hours over, just, pitch a fit, I don't know, right? Or say she's not going. I don't want to be that person, though. I don't, because I'm not that person, and two, that's would be expected. But I don't want them to, not let my mom stay at least that first night. And so, yeah, so, and I don't want them, to do the same thing with my husband. It's kind of silly. Like, it's his kid. The argument's stronger for him. He should definitely be able to stay. So, I don't know. They're all over the place. Well, I'm all over the place because it's my issue. Their rules are their rules. It's more my issue to figure out how to navigate it. Or my mom just doesn't come up until after the baby's born. So, I guess we could do that too. I just would prefer to have her there. And I know she really wants to be there. So, so I wouldn't want her to miss out on the moment if we can have her here. If we can, So, that's where I am with that. So, one last thing. While I was there, I was comparing my bump to other people's bumps, because I know that all of those women, although they aren't exactly where I am, were all in the same trimester. So I was comparing, and yeah, I'm still smaller than a lot of people. I actually get comments on this now when I talk to people at work, since I have let people here know and they find out how far I am along in the pregnancy. It was like, oh, you don't look like that. Someone actually said, are you eating? It was freaking ignorant. But this is why you can't tell everyone. And that kind of made me upset, because it's just like, yeah, I eat. I mean, maybe I don't stuff my face 24 hours a day, like, you know, some people do, but yeah, I eat. I'm not eating for two, because you're not eating for two. So that's the reality. Yes, you do get really hungry, and so I eat, but at the same time, you know, everyone carries differently. So, I don't know. The baby is not underweight. It is not even a small baby. At my ultrasound on May 1st, the baby was already 3 pounds. And so it's not small or undersized. So I don't know. But, and yeah, I'm not even 30 weeks. So I'm coming up to a point the baby still has time to gain its weight. And I was reading that the baby can triple between now and its birth. So let's think, if I have a 3-pound fetus right now, then I might be having again, it's not that it has to triple, but I might be having a 9-pound baby. Now I'm hoping it is smaller than that, like maybe 7 or 6. Easier to get out, but still, but the baby can triple. So for people who think that I'm not eating enough, or I'm starving my baby or starving myself, that is not the case. I think most of the time women overeat when they're pregnant. And honestly, with the heartburn and everything that I'm having right now, I have not had the luxury during this pregnancy to just eat and eat and eat, because early on I was sick. Then I think the second trimester I had the most opportunity to eat. And then this trimester, almost everything I eat causes tremendous heartburn. So I do have a few extra pounds that this baby can definitely suck off if it needs to gain weight. So I am not upset with that, but of course I'm going to continue to eat. But it's kind of ignorant when people talk about the fact, I guess it's a compliment too when they say you don't look that far. But when they start questioning, like, or are you taking care of yourself and the baby, then it's ignorant to me, because it's like, screw you. Just because you became a whale doesn't mean I had to. And maybe I will. I don't know. I still have 2 months to go. Maybe it will blow up like that. But it is what it is, and everybody's different. So, it's nothing wrong if you gain a lot and your body carries it differently, and or if you don't. And I've definitely gained weight, and more than I've wanted to. So, but anyway, I feel like I have to defend it sometimes. So that's just my little rant about that. But so that's where I am, and I will, unless there are any developments, I will come back next week and just give you guys another update. I hope all is well, and I will talk to you soon.